folks, to another New Beginnings podcast. Today we've got with us Peter, and we're going to be talking about the French healthcare system and how to access it. So welcome Peter, thank you for joining me today. Just briefly before we get into the nitty-gritty of what we're talking about, what made you make the move to France?
Well, originally we came here buying a holiday home, and then very quickly, having experienced the Vendée lifestyle, decided that we'd make it permanent.
Mm-hmm. Was that a period of about 2 years?
2 years, yeah. So we arrived in December 17 with the holiday home, and then by the time 2019 had come up, then it was, no, we will do the move permanently and enjoy a totally different type of style of life and a much more relaxing one.
Yeah. So you retired?
Yes. Yeah.
Okay. So coming as a retired couple, what was the next thing that you had to do to make the stay here permanent possible?
Absolutely. There's a lot of things obviously you need to take into account, and the good old Google is a perfect tool for that. But one of the key ones, particularly if you're at a certain time of life, is the medical cover. Yeah. We're all used in the UK to the National Health Service. We're all used to going down to the doctor and the doctor providing healthcare prescriptions, referrals to consultants. So you want to maintain that type of medical cover when you arrive over here. There is a thing that was in existence called an EHIC, which was a European insurance health card, which has now been supplanted by a GHIC, Global Insurance Health Card.
Because this is following Brexit.
Absolutely. So when you arrive over here, you are not entitled per se to health insurance cover. So if you go to the doctor for anything, then at the end of the consultation, you will be charged for that consultation. Mm-hmm. There's a 3-month period where you are not entitled to join the French medical system. And in that period of time, you need to make sure that you've obviously got cover, either via EHIC or GHIC as it is now, but also travel insurance as well, and general medical insurance on there. So we did our homework via Google. The UK government has a website that gives you basic information, but there are numerous other websites out there as well that provide information. And you've just got to do your homework to understand the process of applying.
Because I've said this before, some government websites are very good at telling you what you have to do, but not necessarily where you have to go to do it.
Correct. And the UK government site is no different to that. There are links on several occasions, and you press on the links and it just takes you through to another site that says this is what you need to do, but it doesn't tell you how to go about doing that.
So how did you find that out then?
By consulting various people who had made the move prior to us, and people who had found agencies that could help if you wish to go down that way. There are people, that will help you fill in the forms that's required, if that's the way you want to do it. If you want to do it yourself, then clearly you can.
Did you find the French language a bit of a barrier for that?
Our French, when we arrived, was what I would call tourist French. So very capable of ordering a beer and a steak in a restaurant. But in terms of being able to understand any detailed conversation, particularly when it's key information, then no. So we're rectifying that as we go forward now with French lessons. But again, tools like Google Translate are excellent. Sometimes it can be a little bit misleading, where the understanding of a UK British English word doesn't quite translate to the same understanding as a French word. But on the whole, you can get through it. Yeah. So we got plenty of documents, scanned them into the computer, and then put them through a translation, and then started to pick our way through those translated documents in order to do it.
So what kind of documents did you have to supply?
as people who will be moving over here or have moved over here will know, the French need everything. So if you think that the UK system is bureaucratic, then it's not compared to the French. So birth certificate, standard. Passport, standard. If you are in a relationship where there has been some marriages previously and divorces, then previous marriage certificates, divorce, decree nisi certificates, that need to be photocopied or originals, depending which way around the requirement is, to be put in. And it is heavily, as I say, predicated on paperwork. It is not a online pick it up and apply in that respect. So.
One of the things that I find, even when I moved over here nearly 20 years ago now, everything for women is in their maiden names.
Correct. Yes, and that hasn't changed.
No.
So for Barbara, her maiden name is there. So you end up with basically your current name, married name, and then obviously your maiden name as well, which again can be a little bit confusing for people who aren't used to that.
And how long did all this process take?
For us personally, and I can only speak on personal terms, it took a lot longer than we were expecting. So from start to finish, it was over 6 months. So if you take into account the 3 months that you're not allowed to apply for the French medical care system, and then put the 6 months on top of that, you're virtually 12 months without any formal cover for medical. So if you have a problem, then you will be charged for that, whether it's a consultation with the doctor, a prescription that's issued by the doctor, or if you go down to A&E, you will be charged for that.
But is there still a process in place where if it's all in the process of being done, you get it's a brown form and you get all the information on it, including it's almost like an invoice, and you can present that within a certain period, I think it's a year possibly, you can present that then to the health organisation to be reimbursed once you have got your carte vitale.
Yes, it's for all intents and purposes, it's an invoice.
Yeah.
And you can claim that back through the CPAM malady service.
Yeah.
But again, it's variable. So sometimes you'll go in and you'll have a prescription fulfilled, and they will not give you one of those, depending which pharmacy you go to.
Right.
So again, it's a lottery. If you're aware of it, then you can ask for it clearly, so that you can claim it back. But if you're not aware
and don't ask for it, then
don't
you'll
ask
get
it. You will not get it. No, absolutely. So it's going to be a drain on your pocket all the time. If you use your e-hit card, then the UK government will cover you for a proportion of that medical treatment. Because again, in France, it's not the same as the UK in the sense of free at the point of delivery, NHS.
No, how much is it now? 25?
Over here, it's 70%.
Yes, but for your doctor's appointment?
Oh, in terms of cost, yes. If you rock up at the GP surgery, then you will be charged €25 just for the privilege of attending the doctor's surgery. Yeah. Without a doubt, But in terms of the percentage medical cover, again, in the UK, you're used to it being 100%. In France, it's not 100%. It's 70%. The other 30% has to be funded by another source. Yeah. Whether that's out of your pocket, whether that's out of insurance, it's down to the individual. For a prescription, it could be anything, literally.
It's the cost of the drugs over here. It's not a blanket cost like it is in the UK. It's the cost of the drugs. So if your drugs are cheaper, that's what you pay. If they're expensive, that's what you pay.
Absolutely.
Yeah. The insurance, it's another form of insurance, this health top-up. We call it a top-up or a mutuelle. And you get that from any insurance company? Yes,
again, you've got to do your homework because there's different levels of cover and there's different costs depending who you get it sourced from. We found that the easiest way was to do everything through our bank because it's a one-stop shop and it's providing business to the bank, and the more business you provide, then the better you're going to be looked after at the end of the day.
Yeah.
So our insurance top-up is provided via the bank, and it costs us, because it's a comprehensive one, somewhere in the region of €170 a month. That might sound a lot, but if you get hospitalised...
Yeah. And it also takes into account any pre-existing conditions.
Correct.
Yeah.
If I understand it correctly, again, then the French legislative body have said that you cannot obviously differentiate with people who have medical conditions. So yeah, the insurance companies, whether it be a bank or an independent insurance company, have to provide that level of insurance. Is it going to be weighted? Probably, I don't know personally, but it may well be weighted on there, but they have to provide it.
Yeah, yeah. I know from my own experience, my husband's, he's had a heart bypass, and that it is covered on the insurance, but the premium was slightly higher than it would have been ordinarily, because they have to take into account that there may be an instance where that will need fixing.
The range of additional top-up covers a broad spectrum. If you're just going to take a basic policy, then again it might be a surprise to people. That does not include optical care. So if you need glasses,
that will be extra.
Then in terms of the eye test and then everything else, then that will be extra. But your insurance, if you wish it, will cover that, but the premium will go up accordingly.
And you can add your dental cover as well.
Absolutely. On there. And then there's things, again, that you wouldn't think of from a UK perspective, in terms of if somebody is hospitalised, then some premiums will cover the partner, spouse, to be able to stay in the hospital and have food and accommodation paid for equally, which in some instances, particularly if there's young kids involved, might be absolutely key to parents to be able to be staying in the hospital. So again, all these things that we, as a UK resident coming over, you expect and think of as standard, that's not the case over here.
No, but the hospitals themselves are run slightly different. Anytime I've had experience of it, it's always been a private room.
Fortunately, I've only ever gone through the A&E system. I've not been hospitalised for any length of time, although I did spend one night in hospital. Having gone through the A&E system, and I have to say it was an excellent care, without a doubt. So far I've been in twice, so I am getting my money's worth from the French system as well as the insurance now, with reference to kidney stones. So the first time my attack happened, it came out of the blue, and it literally just floored me. I'd never experienced pain like it ever. I have sort of had conversations with certain ladies about it. It was like giving birth, but I've been assured that the pain was nowhere near the same as giving birth.
I wonder who said that.
But I would quite happy to contest that any time. So yes, phone call to the emergency services. There is a 112 number, which is an English answered line, or the other number is 115. For mobiles 15. For the ambulance service that is associated with the fire brigade. So again, it's different over here. Where back in the UK, an independent ambulance will turn up. Over here, the ambulance turns up, and it's part of the fire brigade. So again, you have to get used to those slight differences in nuances. But the ambulance was here within literally minutes. And then it was off to hospital through A&E, and everything was very efficient. There was none of these horrendous stories that you hear of in the UK at the moment, where you end up in A&E, and it can be anything from a 6-hour, 8-hour, 12-hour. I was processed within literally minutes of arriving.
I think a lot of it may depend, to be fair, on the size of the town. Because it's a small town near here, so it's quite a big hospital.
Yeah, as I say, I've got experience of one, and that's
Yeah.
it. So yeah, it may well be variable.
I had a similar experience, not with kidney stones. I wasn't feeling very well. My doctor took me to the doctor. He said take her straight to A&E, gave me a slip, which we handed to the triage nurse. She said, "Oh, whiz her in," and I was hitched up to some machines. And eventually, little funny anecdote, I said to my daughter after about 3 hours, I said, "If nobody comes to tell me what's happening, I'm going home." So she went and found the nurse and she said, "My mother's having a hissy fit. Could somebody come and sort her out, please?" So this lovely doctor came back and he said to me, "Now, Mrs. Burtonshaw, if I send you home, you will die." So I threw another hissy fit and decided I'd stay where I was.
Absolutely, it's common sense.
So my daughter was sent home and I said, "Come back in the morning, bring some fresh stuff for me." And when she got back in the morning, I'd already been transferred off to the intensive care unit in another hospital. So when she arrived at the hospital, they said, "Oh, I'm sorry, your mother's no longer with us." So
I can imagine what the look would
immediately
be.
she said, "What have you done with her?" So anyway, he said, "No, we've sent her off here." So by the time my daughter arrived, 20 minutes or so after me at the other hospital, I was already prepped and ready for theatre. Yeah. So I certainly cannot fault the system at all.
No, you can't. It's excellent. The key thing that you have to get used to is that it's not free at point of delivery.
No, and I think that perhaps helps waiting times, because if you ring up in the morning, you can get an appointment for that day.
Yeah. But again, it is different. We had a situation not that long ago where I needed to go down to the doctor's. No appointment was made. And I just literally walked into the reception, and the doctor was walking past reception, and the doctor said, "Hello, what are you doing here?" And I explained that I hadn't got an appointment, but there was an issue, and it was like, "Come into the surgery." And there was people in the waiting room waiting to see the doctor. So I was wheeled into the surgery, explained what the situation was, and the doctor said, "Yeah, not a problem. We'll do this, this, and this, and here's a prescription or an ordinance, as it's called over here. Take that, get that fulfilled. And if it's not any improvement, come back and see me next week."
Yeah. The other thing about, you'll get a prescription for a consultant. So if you're going with an issue and you say, "We want to do more tests," for example. My husband had an issue and we said, "Right, we must go and get this sorted." We went to the doctor. He gave us a slip, call his consultant, who's an oncologist, and make an appointment. So you ring up with the prescription and you get an appointment and you go along with that. And we didn't have to wait very long. And we went and saw the doctor and he did some tests, and that was on a Monday. We went home, and on the Tuesday morning, the secretary phoned me to say, "We don't want you to wait until next week to come back for the tests. Can you bring your husband in tomorrow? Because we've got the results." And we went back, and the day he was supposed to go for the test results, he was actually operated on. It was that quick. They said, "No, you need to come back. We've got you in for next Monday. Go straight downstairs now and see the anaesthetist and fill in the forms for him, and then we'll operate on you on Monday."
Yeah, again, that is one of the big differences, is the waiting times. They're virtually non-existent over here. So I was referred with my kidney stones again to a consultant, and you make the contact and you're bracing yourself based on your experiences in the UK to say, "I'll be lucky if I see a consultant within 9 months." And then when they turn around and say 9 days, it's a weird, pardon? 9 days, and it is.
I think I have to say, on a slightly negative note, that can be changing in some of the rural areas. We just discovered last week that our cardiologist that we've used for several years now is retiring, and no one is taking over. So we're going to have to find another one slightly further out of the area. And I know dentists are another one, that there's quite a lot of dentists now no longer taking on new patients. So it may become an issue in some of the rural areas. Yeah,
I mean, we've been trying for over 12 months now to get onto a dental practice, and not been successful. And when you're in conversation with people, you might pick up, there's a new dentist set up in a particular area, So a couple of weeks back, we picked that up on the grapevine that there was a new dentist in La Châtaigneraie. So the following day, we jumped in the car and off we went, and went round all the existing practices. And they were going, no, we're not taking on any new people. But they also did not know of any new practices setting up as well. So where that rumour had come from, I'm not quite sure. But yes, as rare as hen's teeth at the moment as dentists, without a doubt. And the other big difference over here as well is that you're not spoon-fed like you are in the UK. So, as we've just been talking about with your husband, if you go to the GP and they do a referral, in the UK, that referral is sent from the GP into the hospital system, and then you will get a letter at some point calling you forward. Over here, the GP hands you the letter.
And it's your responsibility.
And it's your responsibility. And again, that can be a little bit daunting at times, because you walk out of the GP surgery and it's like, well, I now have to find, you've just used cardiology, I now have to find a cardiologist. How do I find a cardiologist? And where do I get that information? But again, it's not as daunting as it seems. There is a health website that you can go onto. If you then key in, I am looking for a cardiologist, and I am looking for a cardiologist in this area, then they will come up with a list of cardiologists that are in that area.
And the yellow pages, the page on.
On there. But that can be, as I say, we'll hang on a second. And the other interesting thing as well, in terms of data protection, over here, if you go in and you're x-rayed or you're scanned, that is your information. So as you leave, then you're handed the scan, you're handed the x-ray, albeit it might be on a disc to be loaded into a computer, but it's yours. So that next time you then go to another medical facility, you know, you've got your own file and folder to be able to present. So there isn't any national network that's got all the medical history.
No, it's your responsibility for you to keep it. If the over 50s here, women, we have regular breast screening, for example. So every 2 years you get a letter to say, you take this, you make an appointment at one of your centres, take the letter plus the scans from the previous time, and you just, it doesn't matter where you go, and some of them will be busier than others. Some you may have gone and not particularly bonded with whoever's done it, or you know, so you can choose where you want to go, and you just take everything with you and you hand it over. But it's your records. That was one thing I find very odd when we left the UK, and I went to the surgery and I asked the nurse if I could have the children's records and my own to go, and she said, oh no, they don't belong to you, they belong to the health service. And I said, but it's my file. They gave me a summary. But over here, if you leave one area and move to another, you just go to the doctor and he'll give, well, you've got most of it anyway, but he'll give you whatever else he's got. Or you go to the doctor and then he will ask for it to be transferred, and then you'll get it.
Yeah, absolutely. So if you're not particularly good at administration at home, then you may have a problem. But you just got to keep on top of it, because it's all about you. And that probably makes you more aware and more interested in making sure that you're on top of your health over here, without a doubt, on that respect.
So just a quick recap then. You just do a search on Google. Is there any particular one you would perhaps recommend for an organisation to search for that information?
Well, again,
or just a general healthcare in France?
If you just key that in, so healthcare in France and how to access it, then it will come up.
Because there's quite a few English publications and newspapers that go out on a regular basis. They have
French Life, etc. That information will be in there. So you just got to, as always, it sounds as though it's being repeated consistently. You have to do the homework before, and the more homework you do, the more you'll understand, and the easier it'll be. To get what is called the carte vitale over here, which is basically the national insurance card that you
gives you access to the
that you
healthcare.
present when you need medical. That's obtained either if you're a certain age by obtaining an S1 from the UK, and that's obtained from the National Health, and that basically says to the French authorities that as a UK person you have paid all your national insurance contributions, and therefore you are entitled as a fully paid up member to access the same level of healthcare as a French national would do in France.
And you have to supply that, I think, when you go for your carte séjour.
You do.
Yeah.
Yeah, you have to put that in. If you are below that age, then you will have to pay a social payment such as national insurance in the UK. And once you start paying that social payment, whether you're self-employed or whether you're working for a business, then you'll be able to start the process of applying for the carte vitale. And without the carte vitale, then, as I say, it's an expensive
and again,
process.
depending on circumstances, if one of you has come over to work, the other one would be a dependent, and they would sort of be piggybacking on your carte vitale.
There is that ability,
scenarios.
yes. Yeah. So, personally for myself, I at the moment am piggybacking on Barbara's carte vitale. So I get my S1 form next year, so I'll be able to be independent next year.
Okay. But on the whole, my own personal experience of the French healthcare system is excellent.
It is.
Absolutely excellent.
Again, everybody hears and sees these horror stories in the UK. Clearly, yes, there are issues over here. We just mentioned the dental. Trying to find a dental practitioner is one of them. But if you end up having to use the services over here, then you will get to see a doctor, and it will not take forever and a day. If you need a procedure, surgery-wise, you will be able to access that procedure. So, my good lady Barbara has got cataracts. In the UK, as we know, you would be waiting, if not months, years to get those cataracts dealt with. Over here, appointment made at the ophthalmic clinic. Yes, confirmation. You've got cataracts. Yes, they need to be operated on. 6-week lead time. We'll book you in. But then again, going back to what we discussed, once that was all done, they then say, oh, by the way, you need to find your own anaesthetist. So you have to be able to get your head round that you're not going to be spoon-fed over here. But you will not wait for any procedure. So how they do it, I'm not quite sure in terms of comparative terms, UK against, but the way they're organised, it works.
It works. Okay. Well, that's a very positive note to end on. So thank you, Peter, for joining me today. And until the next one, thanks for watching.